Hello, everyone. Good evening, good morning, or good afternoon. We are today here with Hanna Boucher, who is a childcare specialist with ABA, Applied Behavior Analysis. Is that right?
Yep.
Okay. So, for special need kids, and I'm going to hand it over to her to introduce herself more in detail.
Yeah. So I am a registered behavior technician right now, and I'm currently in school to get my master's to become a board certified behavior analysis, or BCBA is the acronym for it.
Okay. Can you give a more detail about it because I really don't know what you talked.
So right now, I'm one who applies the program that the BCBA gives me. So eventually, I'll be the one making the program, is my goal. And it's essentially a program that helps with any skills that our kids are lacking in. So we work on communication and like just home skills, like daily living skills. And some of our kids, we work on academics to like try to get them to get back in school or to start school. So it's a whole big variety of things we work on.
So this is especially for special needs kids or
Yes. So
okay.
its main focus is children with autism. That's like the big go-to, and that's what most centers, that's usually all they offer. The center I work at will take pretty much any kids though. Like we have kids with other special needs, like we have kids with Down syndrome or like genetic disorders. And my place also takes kids who are part of like foster care systems who might not have a diagnosis, just have like behavioral issues because of their upbringing. So we take a wide variety of kids, but the focus is usually children with autism.
Okay. So what do you study? Like basically what they try to study in, BCBA you said, right?
Yeah, so I'm getting my master's in psychology with the focus in ABA. So it's essentially all based on this more specifically.
Okay. So how long you have been working with special needs kids now?
I mean, I've pretty much always worked with it, but to actually do this job, I've been at this location for almost 3 years,
Okay. And
actually in ABA. But I've like did a bunch of volunteer work and stuff growing up, and I didn't know anything about ABA until I actually volunteered for a social group for one in my college hometown. And then I was looking for a job after college, and I saw the place I had volunteered with had an opening, so I was like, I'll go apply there, and I had no idea what I was applying for. But then I fell in love with it and ended up going back to school for it. So
so how difficult, or I would say how different it is working with special need kids?
um I think for me, I don't see a huge difference, but I know a lot of people do because it's just more like their learning style is a lot different from what I know growing up and from what I've seen. And it takes a lot more repetition
Can you
usually.
give an example?
Yeah. So I'm trying to think of just anything that I've taught. So even like some of our kids learning um, like colors, something that
Mhm.
like
That's a
we
very, very basic things, right?
yeah, like something we pick up really naturally. And a lot of times you don't even really have to teach kids that, they'll just sort of get it. They'll figure it out eventually. And we have to do like lots and lots of trials of teaching what like this color is specifically before they've caught on with it.
Anyway,
So
I
it's
think
just a
that
lot
you
more.
have to do with all the kids.
Yeah. It's a lot of repetition. So I know some people can get like frustrated more just because it's a lot slower progress, but then when you do make progress it feels a lot more exciting
And
because it's a lot
accomplished too,
bigger.
I would say.
Yeah.
Okay. And I don't know, you would be also knowing the parents who of the special needs kids. And I don't know, you have any experience that you want to share or, because I don't know. I have personally not seen many, but I have seen a couple of the parents who have special needs kids. And especially, I think I talked to you about that in India, we do not have, I think such facilities like the way
Mhm.
you have, where special needs kids can be taken care of, or they can be basically educated, or
Yeah.
come up to a certain level. So I have not seen that. I just want to understand what parents should do differently, or because what I have seen is they get frustrated easily, and many of the times even socially there comes a lot of pressure on them, just to probably either keep them aside, or not giving them much exposure. They have to be very careful when they are traveling or going for social gatherings, or even at home, many a
Yeah.
time. So what do you think it should be like?
Well, I know that's a huge issue with a lot of our parents here. And that's also why I love my job because so many parents will come to us and almost be like at their wits' end, like they don't know what to do anymore. Like they just don't know how to help their kid and they're trying to, and they have no idea. And so those are my favorite cases because then they can see like these huge improvements that their kids make by sending them to be with us, and how like all these new skills that their kids have that they a lot of times parents don't even think is possible. And so I would definitely recommend ABA, obviously, because that's what I do. But I do know there is a lot of ABA centers that aren't great. So I would also say do your research because some of them are like trying to fix your kids, which is not what we want. We just want to help them be able to be themselves and be able to communicate and tell you what they want. So research into it is a huge deal.
So
And I
but
know even
yeah.
here, like ABA is pretty new. Like it's really taken off, I would say, without in the last 20 years, maybe even less than that. So I know it's not worldwide like a huge thing yet. Hoping it will be, but it's pretty new even here. Like it originally started just in the 70s, and that was like very basic and not at all what we do today. So
What I was trying to ask you, the parents who do not or may not have access to ABA, what they can do.
so a lot of our, like I always say, what we do is teach kids how to communicate and how to be amazing parents because essentially what we're doing is just parenting to the extreme. So our big thing is, well, one, teaching them how to communicate. That's huge. Once you teach your kid how to communicate, that reduces so many problem behaviors, and that's usually our number one thing, and that will immediately reduce stuff. Another big one is we always follow through, which is a thing parents struggle with, which understandably so, because it's really hard to follow through when your kid's like throwing a fit in the middle of Walmart and because they want like a piece of candy or whatever. But like if you say no, mean no, like that's a huge one because a lot of our kids quickly learn, oh, if I do this, then I'll get this.
Yeah.
If I scream and cry, I get the candy. And like once they get those ideas, it's super hard to break like that idea.
So what do you mean by follow through actually?
So just pretty much any like statement you make, go with it. Like don't backtrack yourself.
Oh, okay.
So if you say like we're not going to get candy today and they throw a huge fit, don't be like, okay, here's the candy.
Okay.
Be like, even if you throw a fit, we're still not getting candy. Like you stand by your word pretty much.
Okay. So okay, I understand. I think that I'll also take as a parenting tip.
Yeah, I know I'm like, it's easy to say to do that, but
Oh
then when you're
yes.
actually in the moment and your kids, screaming in public, it's really hard to actually make it happen. So,
So okay. I'm having this question, and I don't know if you have faced such issues or something like this with the, I don't know what age kids you get.
we have all
So
ages.
all age. So
Yeah, we have like 2 to 20, I think.
okay, how have you potty trained any of them? Okay.
Oh, I have potty trained one so far. Um, it's a task. I think it's fun, honestly, is because it is a huge life-changing thing for the kid and the family.
Uh-huh.
So one of my clients, we potty trained, and he was 5 when we started. And so My workplace, we always do like, we call them potty parties.
Okay.
So it's like 2 weeks of intensive potty training where that's pretty much our whole focus. We don't work on really other skills that we've been working on.
Okay.
And oops, dropping stuff. So for our kids, a lot of times it'll be they'll sit on the potty until they accidentally go, pretty much. And then we throw like the biggest party in the world, all their favorite things.
Ooh.
And like a lot of times we'll also like not give them access to some of their favorite things for like the week following up to it. So then it's even more exciting to get like, the Oreos we haven't had all week or our favorite video. And so that's our go-to, and kids usually catch on pretty fast. Like, oh, when I pee in the potty, I get this huge party and life is good. So that's like our go-to method for teaching kids.
Got it. So how is ABA different from the normal school?
So ABA is a lot more hands-on. It's also one-on-one usually for the most part.
Okay.
So I just have one client that I work with. Well, centers do it differently. Right now, because of COVID, we all just have one kid because we don't want to cross contaminate, each other. But I usually have a kid on Monday, Wednesday, Friday, and a different kid on Tuesday and Thursday.
Okay.
So I can sort of switch it up and they can get new experiences with different therapists. But so it's one-on-one. We do a lot more like teaching life skills or like outside of academics.
Mm-hmm.
So our focus is usually
So life skills like?
Yeah, life skills like potty training. That's a big one.
Yes, it is.
For our older kids, we teach like how to get groceries, how to do laundry, like, or like even hygiene, like how to take a shower on your own, and like it really depends on the kid and what they're.
Oh yeah, I think those are big things actually.
Yeah. So we pretty much anything they could possibly want to learn or their parents think would be helpful for them to learn, we're willing to teach them.
I feel it's like more like surviving skills too.
Yeah, is a lot more. It's not as much a focus on school, but we have some kids that start when they're really young, and when they get to school age, they've picked up enough life skills and learned enough that we can get them ready to transition into school. So in that case, then we start working more on like academics, and we work on like how a classroom would work. So we have like sort of mock classrooms where we'll like set up like a story time, like a sit down, where you learn to raise your hand and you learn to get the teacher's attention, stuff like that. So it really depends on the kid's level.
That's pretty interesting actually. Yeah,
it's really fun.
Okay. Any other experiences you would like to share, and any, as I already asked you, about any other experiences or anything that you would like to recommend to the parents who do not have access to such systems or such institutions where they can really send their kids, what they can do as a maybe like a daily thing to make their kids better on the surviving skills side, to make them learn more surviving skills, if you just want to talk about that.
Yeah, so a big focus of ABA is using reinforcement to teach kids new skills. So that's essentially just finding anything they like, no matter what it is, even if it's something that you don't understand why they like. Like we had one of my clients loved looking out windows. It's his favorite thing. So like whatever, if he loves it, we'll go for it. So we would like withhold, like you can't look out the window until we've done this. And then once he gets that, which of course we do a lot of like prompting to help them get it because we want them to be successful. And then we just fade out our prompts. So like, I'm trying to think of something we would have taught him. So we'll go back to teaching colors. So if I'm trying to teach him like, what color is this? Like at first I'll point to it, I'll give him the answer, and I'll slowly fade my actions out until he can do it on his own. And then every time he gets it right, he gets to go look out the window or he gets, a sucker or whatever his thing that he is that he loves. So that's a huge one, is using that to help them learn skills. Also teaching communication, like I said, is really big, which I know for nonverbal kids, that's a huge issue because if you don't have access to speech or like teaching speech, or if they just don't have the ability to learn speech, that is a huge problem for a lot of people.
Yeah. How do you handle them?
So we have a couple different ways that they can work to communicate. So, well, my place also has people who are dual certified. So they're BCBAs and speech pathologists. So that's super helpful because they're amazing and can help with learning speech. But if that's not for our kids, we have what's called PECS, just picture exchange system.
Okay.
So it's essentially little pictures of things they care about, things they want or would want to ask you for that are like on Velcro. And what they do is they just take it off and give it to you, and that's telling you, I want this. And then it's pretty much the same idea with a device, like an iPad pretty much. And there's a bunch of different programs you can get on iPads that have just like buttons that they press and it tells you what they want, like pictures of it. I don't remember all of them. There's a whole bunch, but
No, this is pretty good information. Yeah.
yeah,
Very
so
good. Yeah.
those are great. And that's what we use to teach, like, for if they want something. So like for the kid I was telling you about earlier, he loves food also. So that was like a really big one to teach him. So for his, we started out with PECs, so the Velcro. So he would get like 2 pictures of Cheerios and I don't know, something that was obviously not Cheerios, like a bike. And we'd be like, which one do you want? And we'd help him by like guiding his hand to the Cheerios because we know that's what he wants. And then we'd slowly fade out our guiding until he knows to pull off the Cheerios in order to get Cheerios. And then you just do that with any object, any action, until he has a variety of things he's able to reliably say, like, this is what I want. And then that's a huge reducer of problem behaviors because instead of having to scream or hit you or whatever, because that's all they know.
So, have you handled any stubborn, like really stubborn special need kids?
Oh, yes. The kid I was just talking about, very stubborn.
Okay.
He also would think it was just really funny to like mess up. Like he would purposely like pull off the bike one when he doesn't want a bike. And I'd be like, do you want a bike? And he'd be like, ah ha ha. You make it so hard to know what you want when you're laughing about this.
I think we covered pretty much everything. So thank you so much, Hannah.
No problem.
And we will get in touch with you if you have more questions.
Okay, sounds good.
Thank you so much. Bye.
Bye.
Bye.